Elon Musk reveals COVID vaccine almost killed him. Tesla CEO Elon Musk is the media's favorite for a reason, and this time the billionaire shocked everyone by sharing his experience with his second COVID booster shot. So what exactly does Musk claim, and why does he believe the vaccine has caused more harm to the public than the disease itself? Let's find out in today's video on Twes. Elon Musk shared his own experience with the second COVID booster dose late Friday evening on Twitter. He explained that he ran into severe negative effects as a result of receiving the booster shot. Musk's postings were a response to a tweet from Rasmussen Reports, which indicated that about 12 million people may have experienced severe negative effects after receiving the vaccine. The CEO of Twitter stated in a series of tweets that he had the sensation that he was dying and that a relative of his who was in peak health had contracted myocarditis. Myocarditis is an inflammation of the heart that is listed as a possible adverse effect of several coronavirus vaccines. Musk stated that after receiving his second booster shot, he began to experience serious adverse effects. For several days, he had the sensation that he was about to die. He really hopes that there isn't any permanent harm, but he has no idea. In a third post, Elon explained that getting the second booster was not an option, but rather a requirement for him to visit a Tesla factory in Berlin, which is located in Germany. Musk noted in yet another post that he did not experience any adverse effects after taking the first dose of the Johnson & Johnson vaccination or the first mRNA booster. He sent out tweets that stated before vaccines were available, he was exposed to OGC-19 and it felt like he had a little cold. Then he got the J&J vaccine, which didn't give him any adverse reactions other than a brief bout of arm pain. When Musk made his comments on Twitter, Singaporean businessman Min Liang Tan tweeted that he agreed with Musk's claim. He tweeted that same thing happened to me. I took Pfizer, and Moderna bivalent, and the last shot made me feel terrible. Several other well-known Twitter users said they had side effects after getting vaccinated or getting a booster shot. According to the Centers for Disease Control and Prevention, those who get the mRNA COVID-19 vaccine run a rare risk of developing myocarditis. Most of these rare cases of myocarditis or pericarditis have happened in 16-year-old and older male teens and young adults within 7 days of getting their second dose of an mRNA COVID-19 vaccine, which is Pfizer, BioNTech, and Moderna. After the administration of the Janssen COVID-19 vaccine manufactured by Johnson & Johnson, there has not been an observation of a comparable reporting pattern, according to the website of CDC. Preliminary data from surveys done at least 90 days after the diagnosis of myocarditis showed that the majority of patients had totally recovered. So, is a second COVID-19 booster effective? Updated bivalent boosters that protect against both the original coronavirus strain and circulating Omicron variants became available in September. The CDC has different suggestions for who should get a second booster shot or a fourth shot of an mRNA Pfizer or Moderna vaccine, depending on the person's age and whether or not they have a moderately or severely weakened immune system. Based on information we have, bivalent boosters may not protect well against new infections, but they do help against serious illness, hospitalization, and death, especially in people who are weak. Before the booster was approved, experts from the World Health Organization said in a statement last August that there is more and more evidence that a second dose of vaccines can help restore the effectiveness of vaccines that have become less effective. Experts had hoped that the new boosters, which target the COVID-19 strain that is responsible for most cases in the U.S., would protect people better from getting sick. But two studies, one by researchers at Columbia University and the University of Michigan, and the other by researchers at Beth Israel Deaconess Medical Center in Boston, found that the bivalent boosters produced an antibody response that was the same as, but not better than, the original monovalent vaccines. But for older people who are more likely to be hurt by an infection, the new bivalent booster may help reduce how bad the effects are. An Israeli study on Pfizer boosters came out last week, but it hasn't been peer-reviewed yet. The study found that hospitalization and death rates from COVID-19 were much lower in people 65 and older who got the bivalent vaccine up to 70 days after vaccination than in people who didn't get boosted. A report from the CDC found that bivalent booster doses provided additional protection against COVID-19 associated emergency department or urgent care visits and hospitalizations in people who had already received 2, 3, or 4 monovalent vaccine doses. Musk has been vocal in his criticism of the COVID pandemic, as well as of Dr. Anthony Fauci, who served as White House chief medical advisor throughout the administrations of Presidents Trump and Biden and oversaw the U.S. response to the pandemic during those times. That comes to the end of today's video. We hope you liked it. Please subscribe to our channel, hit the like button, and press the bell icon for more updates.